me to give a presentation on focusing on more on the output-based standards for disease control, and it was named From Surveillance to Action. I didn't select the title, I had to interpret it, but I agreed, I must say. So we have seen this morning that output-based standard assessment of surveillance is not so frequent, so I will try to illustrate that. Well, I will give you a short overview of how I define it, but we have discussed that already. And then I would like to illustrate this approach, and I will use BVD control activities for safe trade of cattle. And I was reflecting during the morning that maybe there has been more initiatives towards output-based standards for this disease, which is a totally privately managed disease. So maybe the stakeholders felt free to propose something which is quite different from what is usually done. And well, for this disease, we will see why they wanted to consider output-based standards. I will describe in brief the approach that we use to evaluate and compare outputs, and I apologize for non-BVD specialists. I will have to give some technical details, and for BVD specialists I will be very quick in these details, so everyone will be frustrated, but hopefully will understand my point. We will see some results in Western France and trying to conclude on how it helps to go from surveillance to action. So, definitions of output-based versus input-based standards. I took the one proposed by Simon Moore here, which states that it provides a detailed outline on the activity which is required. So, as we said this morning, it is a design, descriptive or prescriptive standards. And it is under the assumption and expectation that if everyone do the same activity, then an adequate and comparable output will be achieved, which is not true because we have heterogeneous population, situations, etc. So we know that with standard inputs, we have heterogeneous and sometimes non-comparable outputs. On the contrary, output-based standards, the principle is that you set standards on the performance to be achieved and not on how to do it. And if possible, you state the quantitative specification of the desired result. So it is a result-based approach, really. And then you adapt the method that you have and the resources that you can use to the situation in order to reach these results. And this is clearly closer to the concept of equivalence that is underlying the SPS agreement of WTO than the usual input-based standards approach. Angus Cameron, I've seen he's been contributing to the project. He proposed a description of 3 generations of output-based approaches. The first one is about evaluating surveillance sensitivity, and then you acknowledge that you can use different test combinations, select different sample size, and use different sampling strategies, representative, risk-based, etc. And then you will evaluate the surveillance sensitivity, and we already can find some examples of this surveillance sensitivity approach in OIE terrestrial code for animal health. The second generation, you go further. Instead of just evaluating the surveillance sensitivity, you evaluate the probability of freedom of the unit that is under surveillance and for which you have a result. And then the third one is expected cost of error. So what is evaluating probability of freedom? There, what is the advantage? There you can take into account the fact that you have multiple sources of surveillance. You account for historical testing, that was a question this morning, and you can also introduce in the probability, in your estimation, the probability of introduction of the pathogen. And a very good example has been developed by Simon Moore and colleagues on TB in deers, but I must say it is a modeling approach. It is not a real-life data approach. It is a very thorough modeling approach. It looks very promising, but we have been discussing this morning that this output-based approach is not really very much implemented in practice. The next approach, expected cost of error, proposed by Angus Cameron, there you combine the probability of freedom with the consequence of missing an infected animal. I will not develop that one because here we will take the example of safe trade for BVD and then assume that the consequence when you buy an infected animal is similar, whatever the situation. So, for BVD, why should we consider or could we consider output-based standards? Well, BVD is an endemic disease of cattle. That means that people are trading every day cattle in non-free areas, from non-free farms to free farms, etc., etc. It is, in most EU countries, not regulated, and other countries. And there exists a variety of control plans across Europe, but if you go to France, we have 88 departments, local units, and we maybe have 80 local plans. So if each one is inventing its own plan. For this disease, infectious animals, which are persistently infected animals, the most problematic ones, they often don't show the clinical signs. Many of them don't show any clinical signs. And sometimes we are in the context of information asymmetry. The seller knows more about the animal and his herd status than the buyers. For this disease, we also have a variety of epidemiological situations. In Sweden, they got rid of it, finally, I think. In other countries, it is, the prevalence is quite high. A variety of risks, in some areas where there are a lot of contacts between cattle and also trade between farms, the risks are quite high. And there is a high demand of stakeholders for proof of equivalence, and when they buy an animal, which comes from a free herd, for instance, it is equivalent to other means to do it. So, in Western France, a BVD control scheme has been implemented since a bit more than 15 years now. Well, the control scheme is what we call a Scandinavian type approach, where they do some herd monitoring from bulk milk, because it's mainly in dairy area. In positive herd, they look for and kill PEI animals, persistently infected animals, and they recommend to buy only non-PEI animals, so safe trade. They encourage safe trade of live animals. There is a very good uptake of the program. 13,000 dairy herds and 6,000 beef herds are enrolled in the monitoring, and most of them will follow the PEI animals. And the problem is to buy non-PEI animals, you must find them, and you must pay to have this information. So, how can we guarantee that trade is safe? That means no PEIs are sold, or farmers do not buy PEIs for their farms. Well, there with the stakeholders, we developed an approach to compare their outputs and to use different information, which are, well, sort of surveillance, but targeted to the animals that are sold. So, an originality of this approach that it is at the individual animal level, not at the herd level, not at the regional level. It is at the individual animal level. The first step, well, that was the first step. The second step was to agree on the threshold for output-based standards. What is a probability? And it is a probability of freedom approach. So what is the probability of freedom that people want to reach? In other terms, what is the probability of buying an animal considered as non-PI that is in fact infected? What is the acceptable level of a failure of the system that the farmers will accept? And this was done in discussing with the stakeholders. Then the target population are all the cattle for which we have some surveillance or control action information, and that are likely to be sold. We listed all the possible criteria that can be used to achieve the standard. We monitored the status, well, we recorded the information on all the animals that were considered as certified non-PI based on these criteria. And then we monitored them to be able to see how often the criteria failed. So all these animals were followed up during a certain time in order to see if there was a failure. And this is in fact a continuous process which allows to update the list of criteria and to increase the precision of the results of evaluation of each criteria, which is a sort of surveillance component, in fact. I will now go into an example to make it maybe easier to follow. So, because of the monitoring system, dairy herds are antibodies against BVD are looked for in bulk milk every 6 months. And based on this, herds are classified into 3 categories because we are lucky to have a test which enables to classify herd. Here you have the percentage of the inhibition, which is the ELISA results in the bulk milk, and here you have the prevalence, and you see that we can make 3 categories. If you have a low percentage here, the prevalence of seropositive animals is very low, and if you have a high percentage of inhibition, the prevalence is high. That fits well, which it doesn't work with all tests, but here it works. And once we have considered that, based on previous evaluation, herds which are 3 times 6 months apart on this low category with low prevalence, we assume that they are presumed free of BVDV. That means at least there is no PI animal in the middle of the cows, otherwise they would be seroconverting. So how can we use this herd information? Well, we consider that all cows who are in these herds with repeated very low or low bulk tank milk are assumed to be non-PI. As I said, if one is PI, the other will seroconvert. And you can see that along the years, here you have the years of the program, and the percentage of herds, here down there, the herds which are in the presumed free category, up there the one which are likely to be infected, and in between here. And we consider that all cows from these herds are considered free. So if they are traded, they get a label non-PI, well, with, of course, hyphens, because it's not sure, but it is considered as acceptable. And we wanted to compare this criteria, these components, with individual testing, because the easiest way is to test. And with BVD, we are quite lucky. We have good tools, good tests to certify that an animal is non-PI. How did we select this threshold? Well, we made it simple. We considered that if you use a test, and that was the reference test the most frequently used at the time we started this, which was an antibody for ELISA for antigens, sorry, in broad. We considered that data from the literature on sensitivity, specificity. It is known that in an endemically infected population, you have 2% of PI animals on average. So based on that, we calculated a negative predictive value, and we said that our threshold is 1 minus a negative predictive value, which is 1 PI out of 5,000 cows. So we said to farmers, when you buy a non-PI cow with this criteria, or with the testing criteria also, the threshold is that the probability that this cow is non-PI is lower, is at maximum 1 out of 5,000. We may miss up to 1 out of 5,000. That was the way we selected that criteria. It was this threshold. So it is our output-based standard, the probability of freedom. Then we followed up these animals. So there is a database where you have all the non-PI animals are listed, and when they die, they get out of the database, but they are listed. And each time the status of a criteria is met, then there is a second information, a third information. So, for instance, a dairy cow, if the herd stays negative, every 6 months you will have a new assessment. If the herd stays negative and the cow is in there, that means she is not PI. Otherwise, the herd would seroconvert. So you have every 6 months, for instance, a new criteria for the cow. There is another database where all the results of virus-positive cattle coming from the labs are put together, and if possible, wherever possible, a second test is done to differentiate transiently infected animals, which are not of interest here, and PI animals. And for some of them, we don't have this. So we consider that both the ones that are confirmed PI and the one for which we have no second test, they are considered suspect. They are called PI. So it's PI at large, to take the worst case scenario, in fact. So with this data, we can calculate, we have non-PI animals with of certified animals with several criteria, and we have a list of PI. Well, if the system was perfect, all PI animals would not be certified. Well, if the system was awful, well, all PI animals would be certified. Of course, we are in between. That means some of the PI are certified, and all these cases are what we call our failure events. And then we calculate the proportion of these failure events, and we calculate the proportion of the failure events among all the animals for which we have at least a second result. The second result can be you are a PI, can be you have a new criteria which is favorable. So we can calculate the failure rate, how many PIs are there in all the certified animals for which we have a second information, positive or negative, favorable or unfavorable or favorable. So that gives, long tables, not very nice, where you have the number of cows here for free herds and for cows for herds with low level of antibodies, which is the intermediate category. Here you have the number of animals for which we have a second information, and here you have the percentage of fails, and it was a temporary. It is not 100%. It is a bit lower than that now. So here it is a rate of success. So the rate of failure is 100 minus that, and you can see that for all these herd level information, well, we are well well below the failure rate that is expected. For the PCR also, for the, this is PCR and bulk tank milk, I didn't speak of that, it's okay also. For the antigen negative, it's okay. But for the antibody positive, you all learn that PI animals have no antibodies. Well, it is not true. There are some of them who have. There are good explanation to that. And the failure rate is too high. You cannot consider seropositive animal as a good criteria to say it's not a PI. You have more than 1 out of 5,000 chances to make a mistake if you use this criteria. So to compare the result, to present that, we used a sort of rule here where, it's still in French, where we put the values. Here is the threshold that we have chosen, 1 out of 5,000. Here it is too high, here it is 0, and we can see here we have the PCR neg and the antigen negative animals, so we are okay below the threshold, everything here will be okay. And a cow in herd considered as A, which is a short name of likely to be free, is at the very, very low percentage, a bit more than 0, but a very, very low percentage. So we can see that these 3 criteria are okay for our outcome. Based on that, well, the farmers first, they liked that, and they said, well, we need other criteria, because with this we cover not all the cattle population which we are trading. We are trading young stock for replacement, we are trading calves before weaning. So we will need criteria for these, and we don't want to pay for a test for a calf which has a very low economic value. We cannot pay for that, so we need other criteria. So we tried to see how we could do that. instead of, well, we took a longer history. Instead of 3 negative results, we consider 6 negative results. And we considered 3 groups of animals. And these groups were defined. This one was based on modeling studies we have done. So heifers older than 19 months. Heifers, well, from 0 to 16 months. And calves born, so they were already born. And calves are likely to be born in a few coming days. The problem also is that the calf, farmers want to sell it now. They don't want to wait 3 months before selling the calf. They need the information even before the calf is born. So that's why we use this criteria. So here we have this farm which has 6 negative health, 6 bulk milk tests. And we know that when you introduce a PI animal, a maximum delay to get a positive bulk milk is around 600 days. So we use that information. That was confirmed by both field data and modeling, as I said. And using this information, we say that all these herds, because of this interval, all the heifers that were born before this threshold can be considered as a non-PI. Otherwise, the cows would have seroconverted. For the older heifers, these ones and these ones, well, these ones we couldn't go after 90 days because if there was a seroconversion here that would not have been seen, then the calf born later, we will not be able to get them. I will not detail this now, but based on the same sort of information, we consider that there is a problem with these animals if there is an introduction of a virus during this period, so 5 to 8 months before this threshold, then we will have a calf at risk of being PI. We are likely to see bulk milk to be positive, but all these calves are at risk of being PI. So we said we have to secure this. And to secure this, we said, well, the herd should be negative and there should be no at-risk introduction. That means either no animals bought or no non-guaranteed animals bought. So risk of introduction is taken into account. And we went back to this threshold. I will give detail to BVD lovers if you want. And we also used a criteria where we say we don't want low antibodies, we want very low antibodies because it is more precise here. And that gave us some information so it's all based on tests on the cows and conditions on the epidemiology. And with this information, we give a non-PI status to heifers, well, older heifers, young heifers, and calves, newborn calves. So there is no testing of the animal itself. Here you have all these criteria. Where do they get? Here you have the cows that we had before. Here you have the heifers. This is the result. Here you have the heifers over 19 months, heifers from 0 to 19 months. Here are their results. And the calves, the ones that come from herd with no risky introduction and very low bulk milk. The other calves in the herd that are negative, you see that the output, the failure rate is higher than our expectation. So we cannot use that one based on data, real data. A second request of the farmers was, how can you best, well, they were happy with that again, but then they say, well, we have other information, how can we best use it? So we try to see, can we get something out of pool samples? And can we consider, we know this disease, BVD, is tricky. We know, for instance, all calves born from PI dams are PI. That means that a non-PI calf has a non-PI dam. So if a calf is non-PI, automatically his dam will be transformed into a non-PI. Okay? We know also that calves from dams which are seropositive before pregnancy, well, if you don't vaccinate, of course, they cannot be infected because the cow will not get a second infection. So we try to get some of these criteria. I will not present all the details. This is the overall picture of all the criteria that we have studied. Here are the ones, the test of the animal, PCR on the animal, antigen negative on the animal, and they are good results. Here you have the test based on the herd status. Here you have the dam of a non-PI. So there are a few mistakes, probably some identification pedigree mistake that could happen. Here you have calves born from a dam seropositive, so it's okay. Here you have animals from a PCR pool analysis negative. This is not okay. This is too high. We need extra condition. And here you have the animals seropositive. As I told you, seropositive is too high. It's not, it doesn't work. So you have here a picture of the overall system of where we put all the criteria, sort of surveillance components, compared to one output that we want to reach. So here you have all these criteria. Why do I think that with this approach we go from surveillance to action? In fact, this variety of criteria, they are inputs, variety of inputs that provide equivalent outputs. So we are typically in output-based standards. We can see the sort of criteria we use, testing on animals individually or in pools. We used herd status issued from monitoring data. We incorporated historical results. We were able to qualify animals not only subject to monitoring, but younger animals. And we used some result of modeling studies to try and challenge some criteria. We used our knowledge of the pathogenesis of the disease, and we used epidemiological information where we were able to include some risk factor consideration in the approach. So it applies really to a variety of situations, and we hope it could go to sort of cows we don't have in Brittany at all. What about the coverage? How many cows how many cattle do we get? Well, you see that here each year, 2011, 12, and 13, we get up to almost 1 million cows, which are certified only with bulk milk tests. And all these tests are the ones for young stock, so it's quite a number of animals that get also, these are also traded animals that are certified thanks to the bulk milk test of the herd. You can see that the farmers were asking for us young calves, what we call the 8-day calf, which are less than 1 month, not 8 days, but 2 to 3 weeks. And you can see we started this in 2013, and quite a number of these calves were enrolled, almost 200,000, and the failure rate is quite low. And we can see that the other criteria, well, here you have the mother of a non-PI dam. The problem is that these cows are a bit old, likely not to be sold, but still they are certified. And the other criteria contribute to a very, very small extent. So this monitoring scheme made it possible to give a large number of cattle on the market which are certified non-PI with a threshold that is considered as acceptable by the stakeholders. How much does it cost? Well, it costs the monitoring plus the staff to handle the computer system. Overall, you can see that the cost of the monitoring was about a bit less than €1 total cost per head per year. So you could say it's a lot of money because it sums up every year, but monitoring was not for that at the first stage. It was to classify herds as positive, negative, and to do control. So in fact, it is a sort of a secondary benefit, the surveillance system we get. Well, of course, if we continue, the cost will be there, but still it is considered as acceptable by the farmers. Well, involvement of the stakeholders was very important in this approach. First, they were asking for the question. They wanted to have a mean to certify the animals without paying tests for each animal. So, well, it took a bit of discussion and time, but they understood the concept of output-based standard and they agreed on the concept. That was the first step. Then the choice of the threshold was also a lot of discussion, but in fact it was important to have an explicit acceptance by them of the chance of failure. they say, okay, we are ready to pay, even if it's 1 out of 5,000 chance of failure. It's okay for us. We are ready to take that risk. Well, you've seen that they requested new criteria to cover gaps they were facing in traded animals. And they were requesting also for new criteria, saying, well, you did well with a lot of information, can you do with what is left? So they were really proactive in the discussion with us to develop this approach. Now, how is it implemented? Well, at the national level, well, all this work was done in Western France. At the national level, we are not so advanced. What is accepted is a threshold. The threshold is agreed at the national level. It is the official threshold of ACERSA, which is a certification association of French farmers. And the criteria, well, are discussed, validated, and progressively included in their certification procedures. It takes some time because they say, oh, this is Brittany, it's different, blah, blah. In some cases, they are right, because, for instance, risk of introduction of cattle, of the virus from neighbors is much lower in Brittany than in other parts of France. So some of the criteria, they should evaluate them in their own context, but it's ongoing. And regionally, well, there is a comprehensive database. All is in computers. Farmers have access to the list of all the non-PI animals in their herd, and the PIs, of course. And when they want to buy a cattle, they have access to the information of this particular animal. They have to enter their own farm ID and the national ID, the 10, 12-year ID of the animal, and then they can get the information. This animal, they just get the information. This animal is or isn't in the non-PI database, and then they know what they are buying. So with this approach, I think that we are using a sort of permanent circle where, well, we decide to include a criteria based on previous result request. We implement it and we monitor it, and with this monitoring we are able to confirm or to deny non-PI status. A few of the criteria you have seen, a few of them failed. We were not able to use them. So we estimate the percentage of failure, and well, if it is okay, then the criteria will stay and we can improve, refine, add new criteria. So overall, well, I think we have defined a level of performance to achieve. We propose many different criteria that farmers consider equivalent in terms of the risk they take when they buy an animal. You've seen there are slight differences, but they are all below 1 out of 5,000. That's what they understand, that's what they want. It makes it possible to use a variety of surveillance methods. Well, it makes the best use of available resources. There are little extra cost to do that. And it's an information that makes it possible to optimize cost of certification. So thank you, and if you want more explanation, I'm pleased to answer.